Hi, I'm Michael Webb, and I'm doing this to potentially start a movement, or to continue a movement that's already been started. I would like to say that I am ready to say to everyone that I am HIV positive. I've been living with HIV for the past 4 years, or it would be 4 years in July. This is important for me to say because within my experience of being in the HIV prevention and empowerment field, I'm realizing one of the reasons why our infection rate is so high within the Black gay community is because we're oftentimes so silent about our experience with HIV. Those of us who are positive, we're scared of the stigma, we're scared of the judgment, we're scared of being turned down by our lovers. Most important, I think we're scared to accept it ourselves. And in order to move past that fear, in order to move past the stigma, I think we need to start supporting each other more. I think we need to start being open about our challenges and our successes. HIV is not the 80s, is not the 90s anymore. We're actually quite healthy and we're quite active, and many of us actually go to the gym more than people who are negative. But you don't know that, you don't realize that, you don't see that in the media even, or even in our self-perception of what HIV is, and there's so much fear attached to it, and I want to eliminate that, starting now. There's a lot of anxiety coming out HIV positive. I don't want anyone to suspect that I'm coming out HIV positive for self-promotion reason. I don't want anyone to think I'm taking advantage of a personal challenge or situation to elevate myself or to gain attention. Actually, I hate attention. I'm doing this because every time I test someone who becomes HIV positive, I personally feel conflicted. I feel conflicted because I want to tell them that it's gonna be okay because I'm okay and I'm going through exactly what you're going through, but I can't say it for some reason. I can't say it, and therefore I feel like a hypocrite. I operate on the assumption of being HIV negative, and I don't want to do that anymore. That's the inspiration behind this, and I'm hoping that this empowers others who are struggling with the same issues or feeling like they also want to be vocal to also be vocal. We all need to listen to each other, and I feel like the first step to change is with you, with me, through our experiences. I found out I was HIV positive because I secretly suspected for a while. And I was in a relationship, unexpectedly. I'm very anti-relationship actually. But in 2010 I met someone who was very special. And even though I was concerned that I might be transitioning into being positive, within that relationship, it was just so loving and so comforting at the time. It was my first time being in a relationship, so I hesitated on getting tested for several months, even though I feared that something might have changed in my body. The guilt, our relationship was progressing sexually, and the guilt of potentially not telling him about what might be my new normal, I skipped out on work and I went to Howard University Hospital to their free clinic to receive a free test. Completely nervous, and I convinced myself to do it by saying, I do this every 3 to 6 months. So this is nothing new, this is nothing normal, the test is going to be fine, I'm just worried for nothing. That was not the case. I was told by a very nervous nurse that my life has changed. And she didn't know how to deliver the news. So by her not knowing how to deliver the news, I internalized it immediately as a negative thing. Assuming everything that most people assume when they find out they're positive. Assuming all the worst, all the stereotypes that you're told, which is pretty much death. And not just death, but a sickly death. I didn't know what to do. I didn't necessarily know who to talk to. My friends at the time, I remember us joking around with each other saying, oh, that person is sick, so we shouldn't hug them and things of that nature. So I just assumed that everyone who I cared about, who I loved, were going to abandon me. I would have to deal with this on my own. So I didn't know where to go. I didn't know who to tell, except one person. That was my mentor. She helped me a lot in the past. I assumed that maybe she could help me with this. She told me to go to Whitman Walker Clinic. in Washington, D.C. And of course she said the usual that we all say when people become positive: you're going to be okay. It's not a death sentence. And at the time I didn't really understand what that mean. All I knew was I was positive, but I also was numb. I was also pretty much a zombie. And she told me to go to Whitman Walker, so I walked to Whitman Walker. And then Whitman Walker connected me to care. And the first thing my doctor said was, you're gonna be okay. You're gonna be okay if you take care of yourself. That resonated with me. Because then something clicked. It was as if my virus was in my control. I had control over my virus. It didn't have control over me. If I made the decisions to take my medicine, to go to my doctors, then I'm invincible to the virus. And I will not suffer the stereotype that we all think of when we think of HIV. And to this day, I'm invincible to the virus. And it turns out that my friends did not abandon me. If you see, my friends are actually in this frame, or some of them at least. All of them, all my best friends, they immediately supported me. And I don't know if I would have been able to pull through if it wasn't for my mentor, if it wasn't for my friends, loving me unconditionally, not judging me. But that's not the case for everyone. A lot of people don't have the same support system I've had. A lot of people don't have the same luxury of a Whitman Walker clinic or a Legacy Community Health Services. A lot of people don't even know these resources exist. And it's part of the reason why we need to start having this discussion. We need to create that community to help me, so more of us can become. Gandhi says, be the change that you wish to see in the world. That means so much to so many different types of people. And this is my first step of being that change. If I want a stigma-free society, I need to be stigma-free myself. If I want others to not feel ashamed about their status, then I know I should not feel ashamed about my status either. And this is my first step, and I'm hoping this inspires others to take their first step. We cannot defeat HIV and AIDS by ourselves. I cannot defeat it by myself. My employment cannot defeat it by itself. It's a great institution, but HIV and AIDS will win if we're alone. We can only defeat it as a community if we join together, if we be vocal against those who are perpetuating stereotypes and negativity and contributing to stigma. This is a fight, and in order to win it, you have to be part of the fight. So I would like to reiterate that the whole point of this is to inspire you to be the change you wish to see. We only can do this together, folks. I can't do this alone. You cannot do this alone. Only together. Let's be the change.